So good morning, panel of reactors. Good morning, fellow presenters. This is Rogin Artem A. Alamban, RMD, and this is my study, Comparison of Fasting and 2-Hour Postprandial Lipid Profile Among Selected Medical Laboratory Science Students. Now, let me begin. Cardiovascular disease, such as coronary heart disease, continues to be the leading cause of death worldwide. That's according to WHO. Common testing for CVDs is the lipid profile, and lipid measurements have and continue to be an essential tool to evaluate risk, predict outcomes, and guide treatments for CVDs. The lipid profile, as we all know, consists of total cholesterol, triglycerides, low density lipoprotein, high density lipoprotein, and is routinely done in fasting blood specimen. The fasting means that the patient is restricted with any kinds of food and fluids for 12 to 14 hours, with exception of water and medicines. Now, the fasting time that is done in preparation of lipid profile can be inconvenient with the following. So, number one, or first of all, is the people with diabetes. Diabetic people undergoes medications that lowers down sugar. Now, if the lowering down of sugar is partnered with a fasting, so it can or it might develop into hypoglycemia, which is very dangerous for them. Next, children. Childrens are not really ready yet for that kind of long fasting time. And next, fasting time serves as a barrier when it comes to population screening. We cannot really screen a population for lipid disorders or dyslipidemias directly because of the fasting time. People with other diseases can also be at risk because example of that is those people with ulcers or hyperacidities who needs to eat from time to time for uh, so that their stomach or the esophagus area for esophageal refluxes cannot be triggered. Older people might lose their counting time of or the hours of hour count because they're old people, and it can be hassle to them, or it won't be it won't be easy for them because their testing could be prolonged. They need to come back to the other day to continue, or worse, to repeat the test. So that's our common observations that we also can observe, especially us medical technologists when we work in the laboratories from hospitals and clinical laboratories. So many people are rejected because of under fasting, over fasting. So there. Now, with this, various groups have suggested omitting the fasting requirement for measuring the lipid profile. There is not enough data and evidence yet that non-fasting or reduced fasting time samples can directly affect the testing. Several studies suggest that certain lipid parameters may also be used in the non-fasting state for the CVD management. This includes triglycerides, apolipoproteins, and non-HDL-C. Standard lipid measurements in Denmark are even performed in the non-fasting state, and that is since 2009. Now, this study aims to compare the lipid profile results of people who have undergone both fasting of 12 hours and a 2-hour postprandial lipid profile. This will give evidence of whether fasting for 12 hours can be omitted and be replaced by non-fasting when testing for lipid profile. With this, all those unnecessary or very hassle specimen pre-sample collection can be avoided. Now, dissemination plan, once the study is completed, it can be presented to the DOH or DOST for further study, or can be presented to professional organizations such as medical organizations like the Philippine Society for Endocrinologists or Pathologists, so that they might or they may recommend some changes in the lipid profile preparation. It can also be presented to schools for or for those students who wants to continue the study or to make other variation for the study. Now, the research gap, there is no local study yet regarding the superiority of non-fasting samples over the fasting samples of the lipid profile. That is why we can or there are or the lipid profiles are in the Philippines in most laboratories and hospitals are accepted if the patient has undergone fasting. Now, there can be problems with that because just like what I've mentioned a while ago, there are common problems that are encountered daily, such as long lines, underfast, overfast, and a colleague also told me that she observed that various patients or psychiatric patients are requested or are requested for a lipid profile without even a proper fasting. So that could be a problem there. Now, to date, there is no sound scientific evidence as to why fasting should be superior to non-fasting when evaluating a lipid profile for cardiovascular risk prediction. Now, for the related studies, let's have a quick discussion and look back about lipids. Now, lipids are a diverse group of chemical compounds that are well known to be insoluble with water. Lipid levels are used to predict cardiovascular disease, coronary heart disease, and forms the basis of the National Cholesterol Education Program guidelines. Now, coronary heart disease is prevalent in both developed and developing countries and continues to be the leading cause of death. Lipid profile is used to predict or measure cardiovascular risk and has been a routine test ever since. Current guidelines for the management of dyslipidemias measuring lipid profiles in the fasting state. During the last few years, efforts have been made to simplify blood sampling by replacing fasting blood profile with a non-fasting lipid profile, as it has been found that lipids, lipoproteins, and apolipoproteins were not much different in fasting and non-fasting state. According to the study of Langsted and Nordestgaard, fasting state has been the standard for measuring lipid profile because of the following reasons. First, the theoretical dynamic changes that can occur in test results for same lipid components during a postprandial test. So it means that there might be, or well, as we all know, based from our studies, that there are changes. But according to the related literatures, or based also from what I've discussed a while ago, there is not much support yet that there is a greater difference between both. Now there is a difference, but the degree of their difference is not yet really well studied yet. Now, in many laboratories, LDLC is estimated by Fry-Dewald equation, and since triglyceride are seen to vary according to fasting status during a fat tolerance test, calculated LDLC is also affected. And number three, because this is the way it has always been done, and number four, because fasting has been the standard, there is uncertainty about the cutoffs of the non-fasting lipid measurements. So basically, the what number four means is because it is what the world has followed before. That is why the standard has been set in the fasting state. So studies regarding the standardized levels of the lipids in a non-fasting state is not really that well established. Now, in 2018, Dr. Satish Depankar and Dr. Shakar Pawar conducted a study on young healthy adults ages 18 to 25. They collected two blood samples, one after a 10-hour fasting overnight and another after 2 hours after breakfast. So that study is or the samples are collected in different days. Now, the samples were tested with lipid profile, and the study has or the study presented a data that the results were close enough. So the according to Dr. Satish Devankar and Dr. Shakar Pawar, the uh, the relationship or the difference or the comparison is not really that significant because it's almost the same. Now, for my research questions, this study seeks to answer the following questions. What is the level of lipids, that is the total cholesterol, HDL, LDL, and triglycerides in terms of course, the 12-hour fasting pre-sample collection to our postprandial pre-sample collection. And next, which of the pre-sample preparation is more superior in lipid profile? Could it be the 12-hour fasting, that's what we are used to, or the 2-hour postprandial? Now, third, is there a significant relationship between the lipid profile results with a 12-hour fasting preparation or 2-hour postprandial preparation? Now, based on the findings, what improvements of the lipid profile pre-sample collection can be developed or can be somehow recommended? Now, I present to you my conceptual framework. Now, for this study, I will have two independent variables in the form of the first, the 12-hour fasting prior, 12-hour fasting prior to specimen collection, and of course, the 2 hours postprandial prior to specimen collection. And they will have, or both of them will have a similar dependent variable, and that is the lipid profile results. So there. Now, this research or this study will be an experimental designed research. It aims to measure the lipid levels of each participants both with 12-hour fasting and 2-hour postprandial and comparing the results later. And with that, therefore, this study will also be a comparative study. Now, this study will be conducted at the Liceo de Cagayan University Diagnostic Laboratory in Cagayan de Oro City, Misamis Oriental. Now, for the participants, respondents will be 100 students of the Medical Laboratory Science of the Liceo de Cagayan University, College of Medical Laboratory Science. Now, after a written consent, blood will be collected from the participants twice, one after a 12-hour fasting and on another day from a 2-hour postprandial sample. Now, for my inclusion criteria, it should be healthy young adults between the age group of 18 to 25 years. And for the participants, for exclusion criteria, young adults suffering from any disease, pregnant and breastfeeding mothers. Now, uh, to be honest, for this part, in my participants, the students there is not is tentative kasi I'm still waiting for the comments of the panel, because what I've been thinking about this study is that I'm more concerned on the difference of the fasting and the non-fasting state. So I thought if I use or I thought I can use any participants as long as I can compare both if they have undergone the 12-hour fasting and the non or the post or the 2-hour postprandial. So I thought, my dear panel of reactors, I've thought that um, if I will be needing more samples for this study, the very much or the more accessible to me, as because I'm working in the academe, is my students. So I'll be waiting and I will be very I'll your suggestions will be really appreciated for this study. So allow me to continue. So the data gathering procedure, of course, number one, sending of communication letters to allow me to perform or do my study in the diagnostic laboratory of the Liceo de Cagayan. So I'll be sending communication letters to the president of the university and of course to the dean of the medical laboratory science department. And next, data generation. 2.1 specimen collection from 12 hours fasting. And next, after 2 to 3 days, I'll be collecting on the same patient a 2 hour postprandial specimen. So the specimen collection for the 12 hours fasting, they will or the participants will be asked to fast for 12 hours with no or no food, no fluid, with exception of water and medication. And for the 2 hour postprandial specimen, they are allowed to eat their normal meal in breakfast. And then 2 hours after that, I will be collecting blood for the study. And next, the blood collected will be run by lipid profile. So the lipid profile will be run using the routine method that is used in the diagnostic laboratory in Liceo. And last will be the data compilation for the comparing later on. Now, statistical tools, mean and the standard deviation will be used for the or to will be used to summarize the age and lipid levels during the findings like the total cholesterol, LDL-C, HDL-C, and triglycerides. And t-test will be used for the data from the 12 hours fasting and the 2-hour postprandial comparison. So my reference for this study, uh, this by Anne Langsted and Borch Nordestgaard, non-fasting versus fasting lipid profile for cardiovascular risk prediction. Satish Dipankar, Shankar Pawar, comparison of fasting and non-fasting lipid profile in young healthy adults. Shivanji Gildial, Ashish Prakash Anjankar, Prakash Keshaur Kute, comparison between fasting and non-fasting sample for the determination of serum lipid profile, and Mariske de Vries, Budrin Klop, Manuel Castro Cabezas, the use of the non-fasting lipid profile for lipid lowering therapy in clinical practice, a point of view. Anne Langsted and Borge Nordestgaard, non-fasting lipid profiles, the way of the future, and PK Nigam, serum lipid profile, fasting or non-fasting, and Umakanth, fasting versus non-fasting lipid profile in the clinical practice. So that will be all for me. But uh, thank you so much, my dear panel of reactors, and I really appreciate for any suggestions for the betterment of my study. Thank you so much.